Good afternoon. I'm Jennifer Park, your moderator for the next hour plus. I serve as a consultant to the Build Initiative, and I'm just thrilled to be joined today by wonderful colleagues from Florida. Rachel Spector brings more than 25 years experience in early care and education in both the public and private organizations. She serves as the Associate Director of Programs overseeing early childhood and the Thrive by 5 Early Learning Quality Improvement System, K-5 after school and summer programming, and their innovation fund. She has worked as a therapist, an adjunct instructor, professor, and serves actively on many statewide and local committees and advisory boards that focus on early learning issues. Jennifer Ulysses serves as research and evaluation analyst for Thrive by 5. She's a current Elon Fellow, for those of you who do not know, an Equity Leaders Action Network. And we are thrilled that she's able to participate in this as well, as both a fellow and as a Thrive by 5 leader. She's taken on a leadership role in the Children's Trust racial equity, diversity, and inclusion work. And her background is in microbiology, immunology, and public health, with a focus on maternal and child health and epidemiology. Pretty handy expertise to have in the face of a dual pandemic. Trish Barnett serves as a program manager for Thrive by 5, and her background is in business administration and operations. She brings extensive experience in program management for education-based nonprofits and really focuses on early childhood. Together, they have a powerful team at the Trust. And we are also joined by our other Florida colleague, Herman Knopf. Herman is on faculty at the University of Florida's Anita Zucker Center for Excellence in Early Childhood Studies. He was previously on faculty at the University of South Carolina and has conducted federally and state-funded research. He leverages existing administrative data to build infrastructure to support data-informed policy decision-making. He transforms professional development for early care and education practitioners, measures and supports child and family access to quality childcare services, and facilitates transdisciplinary partnerships among practitioners, policymakers, and researchers to improve outcomes for young children and their families. In sum, Herman is a handy colleague to have when you are launching, constructing, or needing to evaluate the progress of any of your work. Today's plan is to provide information on the Children's Trust, their Thrive by 5 efforts, and some early findings. Herman will share observations about what he has seen in Miami as compared to the rest of the state, and he'll do that with a visual representation of what he's seen through the Sunshine Portal, which you'll get a bonus reveal on. And we will end with a brief discussion and take as many questions as time allows. We are here until 3:15 together, and during this time, throughout the session, we will answer as many questions as we can insert throughout the presentation and also at the end of the presentation. We welcome you to enter those questions in the chat. And we also invite you to share innovations you've been part of or seen in the field that can help us spread knowledge about how quality improvement systems can serve as mechanisms that advance racial equity. We know that the presentation brings us a wealth of information, and we also know that the community brings us so many additional ideas to consider and share out with our colleagues. And with that, I will pass the mic over to Rachel to get us into the good stuff.
Thank you, Jennifer. Good afternoon, everyone. So nice to be here. Just a little bit of background about the Children's Trust for those of you who don't know. Our community is very lucky to be filled with citizens who value services for children and family, and by voter referendum in 2002, established the Children's Trust. We receive our funds from property tax, and we operate more or less at an operating budget of $160 million. Close to $150 million a year are provided through funding to community-based organizations to fund services for the children and families of Miami-Dade County. So we are very grateful to our board, who over the past 5 years, I would say, have really embraced the importance of investing in early learning and early childhood education. I know we have at least one board member on the call today, so we're grateful every year for our continued board support. Next slide. So just a little bit of background, you could go to the next slide, about where we started, and sort of then I'm going to pass it to my colleague Jennifer to speak about the changes we made and where we ended up. So many of you have probably heard of quality counts. We operated a 5-star rating system in Miami-Dade County. We had the ratings were based on observation, classroom environment, as well as a staff qualification standard. So we spent a lot of time collecting documents, collecting education, rating programs based on that, combined with their ERS and class scores. Our program was open to all of Miami-Dade County. So those of you who know anything, our county is huge. We have over 1,400 school readiness providers. And so our program was not limited to any area geographically. All of the programs sort of received all of the different services that we have available. So everybody received coaching, everybody received career advising, everybody had the opportunity to participate in community of practice. And as you could imagine, with the limited funding we had at that time, it was very labor intensive, not a very deep dive into as much support as we would like to be giving programs. And we sort of balanced that out with the idea that programs we could give them stuff, right? We could give them materials, we could give them curriculum, we could buy them supplies, or they could, based on their star level, if they were high enough, we would allow them the opportunity at that point to decide that perhaps they needed to do some capital improvement. And so we came back to our board about 5 years ago with some maps about our progress. And what we found was that in most of the lower income, higher poverty areas in Miami-Dade County, we were not achieving high quality. So we really saw that, our lower star 1, 2, even star 3s were mostly in higher poverty areas. And then most of our star 4 and 5 programs were really in middle to higher income neighborhoods. And so that really concerned us. It concerned our board. And that was the point that we asked permission to go back to the table and start over and really focus our work through an equity lens and begin to bring in providers and figure out a better way for our community. So I think I'm going to hand it to Jennifer, who is going to, next slide, speak about our journey from there.
Yes, thank you, Rachel, and good afternoon, everyone. And so again, just continuing with, as Rachel just, gave us a overview, right, of how we have moved from quality counts, and now we're going to move into how we've now moved into our Thrive by 5 QIS system, and thinking about how do we accomplish creating high quality early learning environments for our youngest learners in Miami-Dade County, and how do we actually strive for equity? There are questions that are very important for us to ask and really reflect on that. To hold us accountable in order to achieve those goals that we want. And so some of those questions have included, thinking about who are we serving, and how well is that matching more or less the intended population that we want to serve. And so we'll see that there was a difference within the quality count system where it was a lot more broad versus where we have moved now within our Thrive by 5 system. What is the specific population that we wanted to target? We see that there's a difference in that. We really wanted to take some time to reflect and say, well, what supports our programs, receiving, and what is the workforce? What access to resources and supports does the workforce have, and children and families? And really looking at this kind of dynamic of all the different layers that make up, our early childhood system and what supports are being received there. And then obviously thinking about the structural process benefits and what is the long-term impact if we're saying, ultimately, as we'll see throughout, our presentation, that one of the things we're striving for is that all children, will be ready, school ready to, to enter kindergarten prepared. And so, how do we accomplish that? How do we strategically accomplish that with the resources, that we have? Next slide, please. And so what we learned as we began to move again from our quality count system, again, and kind of just keeping some of those questions in mind and looking at what now creates our current Thrive by 5 system, we realized that we really wanted to target, our access, targeting our access specifically to high poverty, high need census tract areas. We really wanted to make sure that our supports were benefiting, our youngest learners at the most critical stages of their development. So looking at that infant and toddler stage was very important. Beginning to really limit participation in the sense, as Rachel said, that it was vast in terms of the number of programs that we were supporting. But now since we were really targeting our focus to high poverty census tracts, that began to really kind of limit the participation and ensuring that there were certain criteria in terms of the number of children receiving subsidies that were participating in our support, and just making sure that a lot of what we were providing to support our programs, the workforce, children and families was very tailored to the needs within that community. We also then began to look at a way of helping to drive the market for our early learning providers by providing tier payments to programs. And we also realized that an important component, and when we think about how do we create, even equitable systems, and how do we create systems that are reflective of what truly is needed by our, the early learning community, we've seen that provider voice is very key to that success. And so as we begin to really rethink, what is that R when we think about, a QRIS system, what we really want to accomplish is helping families really to have high quality early learning experiences. And so we have within our tier system, or the way that our programs are divided, our early learning programs are divided, we have tiers 4 and 5 that have been more or less determined as high quality. And that will be discussed a little bit more as we move into some of the further slides, and how we can also just drive towards full enrollment, and ultimately that's helping to correct the early learning market. Next slide, please. Another aspect that I do want to just point out and acknowledge, I know Jennifer mentioned earlier, so I am an ELAN fellow, which is the Equity Leaders Action Network, which is ran by Bill. And the trust has always been very intentional, especially within what we're doing within our Thrive by 5 system, and finding supports and ways that we can ensure that what we're doing is equitable, and that we are, addressing the needs of our community. And being a part of this particular fellowship is one of those avenues. And so I just wanted to make sure we give a shout out to that, the work that we're able to do through this fellowship, or the supports that we're receiving in terms of helping leaders to build strategies and building the capacity of all those who are participating to actually examine, the structural policies and practices and the way that we're distributing resources to ensure that we're not, inadvertently, right, continuing to perpetuate inequities is very much important. And so my participation within this fellowship, and we actually have one of our Thrive by 5 partners who's providing supports within our quality improvement system, who's also a part of this fellowship. And the ability for us to engage in these conversations, to critically look at our current QIS is very important. And we're very appreciative that we have the support through Build to be able to do that. So next slide, and here I'll pass it on over back to Rachel, and we'll talk a little bit more about specific details of our current Thrive by 5 system.
Thank you, Jennifer. So just to continue, you could go to the next slide. Just to share a little bit about our vision and sort of what we've been able to put in place over the past 5 years, once we were directed by our board to go for it and start to re-examine sort of, each component of our system and then the system as a whole. So what we realized, as Jennifer mentioned, is that the providers in these specific neighborhoods, for a variety of reasons, complicated reasons, different funding streams, reimbursement rates do not have sufficient funding clearly to achieve and maintain high quality on their own. So I want to go back and mention we do have specific criteria for programs to participate in our Thrive by 5 QIS, which is that they must be located in a high poverty census tract. They must serve infants and toddlers, and the 30% or more of the children that they serve are receiving a child care subsidy. So we are really targeting a specific segment of providers. And so the first way we were able to sort of infuse some funding is through high quality payment differentials. We are lucky that our state, through the Division of Early Learning, has payment differentials in place. We have classified our programs in levels of tier based on the class composite score. We are also lucky that the Division of Early Learning administers class assessments to most school readiness providers, which is also a requirement to participate in our program. And using the composite score, we've placed them into tiers. So we have been able to layer on top of the tier payment differentials offered by the Division of Early Learning at the state level. Ours are higher. And then the other difference is that we've been able to offer our payment differentials to all children. So taking, again, like a whole child, holistic approach, we offer our payment differentials based on enrollment by the month, not on attendance, and we support all children. So just as a quick example, if a provider has, 30% of their children are receiving a school readiness subsidy and they're in the highest tier, which would be a 6.0 composite class score above, they will be receiving 12% on school readiness children from the state. They will be receiving additional 3% from the Children's Trust on the school readiness children, and the full 15% for every private paid children enrolled in their school. So we do see the payments making a big difference. We have conducted surveys ongoing, and we learn from our providers that a high majority of them are reinvesting the funds back into their teachers in the form of teacher bonuses, salary increases, or other ways of incentivizing and rewarding their teachers. The second, I would say, biggest component, which sort of falls into both of the benefits for families and also benefits for program, is our child scholarship program. So we really were very intentional about this component by really taking a look at our community and the gaps, and using a 2-gen approach, really trying to focus on helping lift families out of poverty and to help them avoid this benefits cliff as they continue to improve their economic self-sufficiency. We're supporting families up to 300% of the federal poverty rate, which goes, again, above. In Florida, it's 150% to qualify for the school readiness program. So our program goes up to 300%. The program has been a huge success in that we have over 800 families enrolled so far. We do have a huge waiting list. COVID came in the middle of all of this revamp and just, the job market in different situations. So amazingly enough, we have no wait list in Miami-Dade County for the school readiness program. We have a huge wait list for our scholarship program. And then some other, in terms of professional benefits, I know that workforce is on everybody's mind lately, and we certainly value our workforce here in Miami-Dade County. So we do have a range of supports for them. We do have an early learning career center who is led by a colleague who Jennifer mentioned is also an Elon Fellow. And they offer career advising for educators to really develop intentional career pathways and career plans. And then through our continuing education scholarships, we will fund them for credit-bearing coursework, for childcare credentials, for document translation, local conferences. We've developed in partnership with our institutions of higher ed, bilingual cohorts for our non-English speaking educators. So we really, their team has gone above and beyond to really provide as many educational opportunities to our providers. And then we also have been funding for the past many years a salary supplement program. We're currently using the incentives model. And this program is really aimed at supporting retention and also incentivizing continued professional development. I see a question in the chat, I think, about centers and family childcare homes, and we do welcome both. We actually, Trish is going to talk later about numbers, but we do have many family childcare homes participating in our system. And then one thing Jennifer had mentioned, which we find is like sort of the key, I would say, to our success, or one of the most important pieces, is our provider voice. We started a provider advisory committee. It is, providers are selected through an application process, and it has been really an amazing opportunity, I think, for us to really hear from, those on the ground and really work with our providers as the experts of their programs and of their neighborhood to really understand what is it that programs need to achieve and maintain high quality. What is it do they need to continue to support the children and families and the neighborhoods in which they serve? So that has been a great addition and a real benefit. And then our sort of cross-cutting strategies, if you will, we support with our partners at the United Way. Teaching Strategies Gold, we really want to be able to measure some child outcomes and measure how children are progressing through our system. We've done this again in a very intentional, equitable manner, making sure that the programs that we're working with have the basics, right? Like, let's not go in with these curriculum and all of this fancy stuff if the programs don't have access and the teachers don't have access to appropriate internet and they don't have access to appropriate hardware and software and computers, cameras, and time, right? And they need to have the time, planning time, documentation time. So really being intentional and working with the whole program and teachers around that. And then through our partners at the University of Miami, we've been working with Georgetown University to adopt their framework for infant and early childhood mental health consultation. We have adapted it to the Miami community. It has been invaluable, I think, to our educators, really coming, from a place of wanting to eliminate any form of preschool expulsion or biases that people may or may not understand that they have. So this support really works in 3 levels. It works at the program level to really examine policies, procedures between staff, between families, and then also working with teachers in a more of a consultative stance, different than coaching. Our mental health counselors are all master's level clinicians trained both in mental health and or early childhood. They are all going through the Florida Association for Infant Mental Health endorsement at this time, alongside the infant and toddler teachers that they're working with. So we feel really grateful that we've been able to sort of infuse all of these different type of supports that we feel are really, moving the needle for our programs. Next slide. I'm going to hand it over to Trish to talk about our partners. And
Rachel, before you do that, we have a question
Sure.
about the coaching, who provides it, and what's the dosage that participants receive when they request coaching.
So so when we moved to Thrive by 5, we did move away from I'm going to say generic coaching, just for lack of a better word, for this, like, I'm going to come in and coach you on, whatever is sort of happening today. We offer coaching through either the child assessment, through the Teaching Strategy Gold implementation coaches, and we offer consultation through the mental health consultants. So for the mental health consultants, they stay with the program for typically a minimum of 6 months. It could be longer. It could be a little bit shorter if the program's ready to move on. it is a process. So they start working with the directors or the owners, and then through that process, identify teachers that either self-identify or are identified through conversation with their directors. So it's something it's not like I'm coming in to coach you. It's been through a conversation, through building relationships, either the teacher, the director have agreed that this is something necessary. It's not around a specific child, it's around overall, you know, how to address challenging behaviors in general. So that would last anywhere, I would say, with the teacher level from, I would say, 6 weeks to maybe 7 months or 8 months, depending on sort of, you know, the relationship with the teachers. The mental health consultants have very, very low caseloads. So they typically spend at least a full day in each program. So they really become, you know, embedded and part of the team. For the teaching strategies goal assessment, the coaching is, we have COPs, and they do training, and then they get the implementation coaches. I would say that it is not time limited in that program. It really depends when the teachers, the educators, and the director feel like they're at a point where they're sort of ready to be on their own. We operate a cohort model. So we do have, like, for lack of a better word, beginners, intermediates, and advanced programs. And so obviously I would say the intermediates are probably getting like the most hands-on coaching. Once you're in advanced, you're getting more check-ins because you're pretty much, you know, you're entering your observations, you're using the data. Maybe when you're transitioning to sharing with families, you might come back and receive some more coaching along the way. And the beginners are sort of in that beginning phase, taking more training, participating in COPs. So again, it's very individualized. I think if we learned one thing from our 10+ years in quality counts, it's that our services for educators need to be individualized. All of the services are there. Providers do not have to participate in any services if they want. It's really about making sure that, you know, the owners and the directors and the educators are taking control sort of their quality journey and how they approach it.
So as Rachel mentioned before, we offer this menu of supports, and we really had to make sure that we got both local agencies and state level agencies on board as we were developing this program. So as you can see, this slide here lists our partners that are really helping us carry out the supports that you see through the Thrive by 5 program. We also partner with our institutions of higher education as well to help us carry out. So ensuring that the community is coming with you to build the system for Thrive by 5. Next slide, please. So this slide just kind of sums up the programs by numbers. So for our Thrive by 5 programs, which consists, as Rachel mentioned, of both centers and family child care homes. We have 291 programs that are currently enrolled in Thrive by 5. They're receiving those tier payment differentials as well. We have 815 children that are currently active on our Thrive by 5 scholarship. And again, our waitlist is ever growing with currently roughly around 1,300 children that are on the wait list right now, and that is changing by the day. 106 programs received our mental health consultation. 28 programs received the teaching strategies gold coaching, and then 3,153 educators received trust-funded professional development supports. So as Rachel was talking about the intentionality with our consultation and our coaching, you'll see those numbers are a little lower, but it really shows the intentionality of those programs. Next slide, please. So as we've kind of been on this journey of Thrive by 5 and continuing to learn not only from our experience with quality counts, but as we're actually implementing the program at hand, we're really ensuring that we're focusing on that equity-driven partnership and really giving the trust to our providers in their decision-making and really driving their journey for quality. So again, we keep mentioning over and over, but driving home the point that the provider voice is truly the key to success. We've also seen within Thrive by 5, what childcare programs really need is money. So kind of moving away from the very coaching heavy quality improvement system to more a financially based system. Programs are really taking that financial investment that we have put in and putting it back into their teachers, whether that's through different supplements or whether that's through pay raises. They're really taking that financial investment and putting it back into their teachers. We also are learning that there's a need for informal pathways within our professional development supports. So really expanding and providing equity and more accessible pathways that fit where our educators are. We're also seeing, again, as I mentioned before, that money is really being invested back for the teachers. And what we're really trying to do is shift away from this funder-driven compliance to really guiding the decision-making with the provider and having relationships drive that quality improvement journey. And we truly believe that our childcare operators are the experts in this field. And through our provider advisory committee and our relationships with our providers, that they're really the ones that are driving this program and telling us what they need, and we're making sure that we're adhering to that. And with that, I'll go ahead and pass it back over to Rachel.
Well, Trish, before you move on, I'd love for you to talk about how real the trust commitment has been in providing a financial grant, basically, to programs and letting them be the decision makers and driving how they use that money. Tell us about that process and, if that has worked out well and what you know about how folks are investing those dollars now.
Rachel, do you want to go ahead and take that question?
I mean, I think that what we've, I want to say, like 5 years ago, we had similar questions from our board when we took all of this sort of our ideas there. And I think that the biggest, I don't know, what I could say is that we really need to move away from a compliance oriented and wondering what they're doing with every single penny, trusting that owners know what they need to serve the children and families and their community, and trust that that's happening. We feel confident because we see the results in the class scores. We see the results in the amount of professional development that teachers are engaging in. We see the amount of applications that we receive when we just recently opened the provider advisory committee, and how many owners and directors wanted to contribute and be a voice for this system. So does that answer your question?
Yeah, I think the other thing I'd love you to just speak to is while you all are not administrators of CCDBG, you have a board that is highly involved and provides a lot of oversight. And so that must have taken some convincing on your part to not be compliance driven in providing the financial incentives. Can you speak to what that process looked like, and if there was a lot of convincing or there was early buy-in?
I think that, so we do have a very large board. And so what we sort of gathered our early learning cheerleaders, if you will, from our board, and sort of packaged and presented the issues that we were seeing, the inequities in our system that came to light as we sort of engaged in some evaluation processes. And really, the Children's Trust as a whole was really moving into focusing on equity and looking at all of our funding decisions. However, there is this stigma about childcare that, oh, the owner's gonna take the money and buy a new car, right? Like, we've heard that a lot of times. And so we really needed to put in place methods that would show, that people are making progress. So multiple meetings, we did bring in, experts like yourself, Jennifer, like other state and national experts to really share with our board also what was happening at the national level. With the help of our provider advisory group, we did come up with a sort of, I don't want to say the word monitoring, but I'm going to say it like a monitoring, maybe like an accountability system, so that because in addition to the tier payment differentials are paid, as I said, on enrollment. So we also really wanted to make the process very simple and not burdensome and not, you know, tied up in a lot of bureaucracy. So they simply come in, enter their enrollment once a month. It takes 5 minutes. They're paid on that enrollment. So our system is really that we select our database system, which is the Wells database system, has been an amazing partner in sort of tailoring our data and our provider portal to everything that the providers need and that we need. So the system randomly selects 10% of our providers every quarter. We go out, we visit them, we collect their food records for half of them, we visit in person. Jennifer, Trish, and I are the team. We have conversations, we eyeball the number of kids. And so we believe that the fact that they sort of know that their turn is coming up next, people are honest about the enrollment. We have not had any issues. We did conduct a survey. We had a very, very high response in our survey, and we're glad to learn that what we hoped would happen happened. Teachers are owners and directors are investing in their teachers. I think that because our state has sort of mandated class assessments, if you serve, 20% or more school readiness children, owners have really understood that, this all rests right on their teachers and the quality of their teachers. So it really is in their best interest to support their teachers and appreciate their teachers. And while unfortunately in Miami-Dade, teachers are not yet paid a living wage, we hope that through all the supports, including the salary supplement program, that we're helping educators get closer to that living wage.
Yeah, thank you. And Wells has been a wonderful partner to many of us, and I see that they're joining us today. So Carlos, Muriel, and Anna, I see it. The three of you, and I'm sure more team members, to listen to hear how else they could further improve supports for this team. So thanks for joining us today too. There's another question in the chat too around the cost of this initiative. So could you speak to how much you all have invested in Thrive by 5? And then also in that other slide, you had a number of children who are waiting to be served. I'd love to be able to kind of know what the figure would be to allow this to be inclusive of everyone who's kind of raised their hand interested in participating. You're muted still.
Thank you. Our Thrive by 5 system, which includes the tier payments and the scholarships. So right now we invest $8.5 million a year for tiered payment differentials, $9.5 million a year for child scholarships, which we're paying the full cost of care minus a small co-payment plus the tier payment differential. In the mental health consultation, we invest $3 million a year. Child assessments, $1 million a year. The salary supplement program, $2 million a year directly into the pockets of teachers. Our educator scholarship program, $1 million a year. And then I would say that we have another like $1 million in sort of admin costs. We have our Wells contract, and then we also have a contract with the Children's Forum for a professional development registry where we capture all of our educators' education. So we're able to produce a yearly workforce report. Yeah, so I think that adds up to about 25 million, more or less.
That's pretty impressive, Rachel. Off the top of your head, you're able to get those figures.
And then we And then, so we do, as Trish mentioned, we have over 1,100 families on our wait list. We calculate the average slot, if you will, around $8,000, which I know it sounds very sad, but it's an average number because, you know, obviously if it's a preschooler, if it's an infant, if you're in tier 5, if you're in, you know, depending on the size of your program. So that's how we sort of calculate it. So we are, you know, out looking and hoping others want to join. We are looking at about $10 million that we need to support the rest of the children that are on our wait list.
Awesome, thank you.
And it might be just on the next slide, it might just be a good time because I do want to say that I'm not going to go over each of these. If somebody has specific questions, I'm happy to speak at a later time, but we've been really focused on our Thrive by 5 quality improvement system, but we at the Children's Trust also understand that, you know, children, we support the whole child, and then children attend early learning programs. They also live in families. And so we want to make sure that children are supported in across the developmental spectrum. So we do fund like another, I would say, $10 million maybe in these programs a year that you see on the screen. So we have different programs for early literacy supports. We have a book club that is open to every single child birth to 5 in Miami-Dade County to get free books mailed to them with guides and activities for parents to engage in. We fund specialized autism evaluations for children that are at risk and cannot otherwise afford, you know, this battery of specialized assessments. We have summer programs for children that receive Part B and Part C services during the school year. So vision, parenting, home visiting, match. We fund the Early Head Start Child Care for match with many providers in our community. So we're really trying to support whole children and families with an array of supports under the birth to 5 age range. So I just wanted to take a moment to point out the other areas that also fall under our Thrive by 5 initiative.
And we have a resource that the team pulled together that I'll drop in the chat that summarizes a lot of this information as well. There are a couple of questions around the career pathways for the childcare professionals, though, that I didn't know if you all wanted to speak to really what those informal pathways are referring to, and also what types of models exist for supporting professionals along those pathways. One question is if there's an apprenticeship model or others?
So yeah, we are, so as I mentioned, we currently are using an incentive program. We are in the process of developing our own salary supplement program. Specifically for that reason, we want to build out an informal pathway. So I can't say that we have it built out yet, but we are working with all of our partners and looking at, you know, different credential badges, stackable credentials, English coursework. We're looking at all of the options. We're in the gathering information phase. We're looking at all of the options because we really want the program to reach those that need it most and those participate, you know, working in our Thrive by 5 programs, and that may or may not, you know, there are barriers. And so we want to remove all of the structural barriers to engaging in high quality professional development and reward it. So we are in the process of that. I know there was a second part to your question.
If apprenticeships were included.
Oh, so, well, we, I know that we have Pam Hollingsworth on the line from our Early Learning Coalition, so I'll just say on her behalf that they have been working very hard, our local Early Learning Coalition, with our Career Source and Miami-Dade College to develop an apprenticeship program. It is going to be an amazing opportunity. They've developed not only an apprenticeship program, but an internship program that will bring people in as an intern and then allow them to transition to an apprenticeship program where the salaries will be partially funded by CareerSource. I believe at $13.80 an hour, which for Miami is unfortunately a good rate, and provides a lot of resources, and the apprenticeship program will hopefully lead to folks staying on in the profession.
Awesome. And I know we've got some state colleagues on the line as well. So thanks for joining us. Another question is kind of the coordination with the state, Rachel. So have ARPA dollars been supporting any of these efforts? What are we thinking in terms of the federal dollars that are being presumed available to distribute to states?
Yeah, we are just, I think, the Children's Trust joining late maybe in those conversations. I know I did see that most of the dollars are going through the local early learning coalition. So we are definitely supporting that effort and helping to get the word out to our providers. But we are hoping to have some conversations with the folks at the state level, because we do feel like we have a pretty great ear on the ground about what's happening in our community and what our providers and our most vulnerable neighborhoods really need in order to continue to offer high quality care.
Great, thanks so much. I think we're caught up with the questions in the chat now.
Okay, I think we're gonna turn it over to Herman.
Well, good afternoon, everybody. Let me get my screen up here. There we go. So just to provide, I guess, a little background. So, at the Anita Zucker Center at UF, we've been collaborating with the State Division of Early Learning and coalitions throughout the state to develop a measure of childcare access in Florida that uses state administrative data that captures the enrollment history for children that are participating in Florida School Readiness Program, birth to 5, and the available capacity of high quality early care and education services that are available, reflected by providers agreeing to participate in Florida School Readiness Program. And in a meeting, I don't remember when it was, Rachel, we were talking about what we were seeing as we were looking at some of the data with the FLICA, and our team noticed that Miami was operating a little bit differently than some of the other counties or coalitions throughout the state. And we kind of inquired, what's different in Miami? And of course, you see all of the great work that they're doing through the Thrive by 5 initiative. And we saw some really different patterns relating to access for a system that covers many more providers and children in the area than the Thrive by 5 area program is able to cover, but we were still able to see some community level differences. And so I'll provide a brief orientation to what we have in the Sunshine Portal through the Florida Index for Childcare Access, and then we'll walk through what access looks like in Duval County first, just to share as an example of kind of some common patterns that we're seeing, and then I'm going to jump to Miami-Dade to show you guys what it looks like down there. And so first, when you log in, you see this map that has all different colors on it that reflect the extent to which children and families who are participating in the Florida School Readiness Program have access to quality early care and education services. The user can define the quality threshold that they're going to use to measure access by. Currently in the state, to participate in Florida School Readiness Program, you have to have a class score of 3.5 or higher if you're serving 20% or more of your capacity allocated to the School Readiness Program. But next year, it's going to change to 4.0, which changes a little bit what our accessibility looks like throughout the state. But many communities have identified class at 5.0 as kind of our marker for quality. When you're looking at the map, we're measuring two different components or aspects of access. First is infrastructure, which is probably a concept that most of you on the call are familiar with, where you're really looking at how much capacity you have in a given area to accommodate the demand as expressed by enrollment in that specific area. And so an area where we have positive infrastructure, we have more capacity than we have children that are using the service through Florida School Readiness Program. If it's negative, then we have more children enrolling in care than we have high quality spaces available to children and families within that zip code or in that community. In selection, we're looking at the rate at which families are enrolling in high quality services when high quality services are available in the area. And so for that, to calculate selection, we look at the utilization rate of high quality services, and we compare that against the utilization rate of not high quality services. And then the end result is either positive or negative, negative indicating that families are not enrolling in high quality services at a high rate. If it's positive, families are enrolling in high quality services at a high rate. And then those measures are then shown on the map visually with bluish, blue to white areas indicating that our infrastructure is positive, and so that we have enough high quality space available to accommodate the demand of children using the service in the area. As we're kind of red or dark purple on the map, these are areas where we do not have adequate infrastructure in the map. The blue and red mixed show a purple area, which indicates that we have inadequate infrastructure, but that we have positive selection. And so in those areas that are dark purple on the map, we have a high rate of utilization among families in high quality services, but we don't have enough of that high quality service in the area. In areas that are white on this map, we have adequate infrastructure, but parents are not enrolling in that infrastructure in those areas that appear white on the map. The darkest red areas in the map indicate that both selection and infrastructure are negative. In most instances, infrastructure is kind of driving that indicator. And so that if you don't have high quality infrastructure in the area, you're not going to see very much enrollment. And then the blue areas are kind of the best circumstances where both selection and infrastructure are positive. And so that families are enrolling in high quality care at a high rate, and we have ample infrastructure to serve additional families within those communities. And let me turn over to Duval County. And so we'll zoom in to one of our other major metropolitan statistical areas in Florida. And let's bring that back down to 3.5 as we're looking at quality. And so when we're just looking at quality and infrastructure, we see a lot of area that is kind of light blue in the map and some darker blue areas in the map, which is letting us know that our infrastructure is looking pretty good, particularly, on the from this one zip code over as you go west. Infrastructure looks pretty good throughout the Duval County area at 3.5. When we jump to 4.5, we see some holes appear as it relates to infrastructure. And then if we jump to our 5.0, we see even less available high quality infrastructure for children and families in the area. But of interest to our folks at the Children's Trust in Miami-Dade is really, how does this relate to areas where we have elevated levels of poverty? And so if we kind of recalibrate the map here, we now have shaded gray on top of our infrastructure measure, which is showing white, pink, and red. White is positive infrastructure, pink is negative, but kind of moderate, and then red is more pronounced negative infrastructure. And then we see in the areas where we have elevated poverty rates in Duval County, it's all kind of our most significant negative infrastructure category at 5. If we drop that quality threshold down to 4.5, it's better, but throughout county. But if you look at the areas where we have elevated poverty rates, it's still pretty negative in terms of infrastructure. But one of the things that was interesting to us as we were diving into Miami, and we'll switch over to Miami-Dade County here.
And for those of you who aren't that familiar with Florida, Duval County is the Jacksonville area, the north part of the state. Yep.
And Miami is huge, and so you have to zoom in. But so we've held quality at 4.5. You saw what it looked like in Duval County, and here's what it looks like in Miami-Dade County. And that our areas are clustering of more pronounced higher levels of poverty is showing that we don't have nearly the significant deficit in infrastructure when we're looking at the map. And I think that this partially shows how the broad types of interventions that they have engaged in to support access to high quality early care and education services through the Thrive by 5 initiative that has been targeted in areas with elevated poverty is resulting in broader access to these services. And I'm going to load the providers on the map also, because Miami has been focused in describing and talking about quality for over a decade in the community. And there's some other differences when you look at our provider distribution as it relates to the type of quality services that are being used in the area. And so one I want to highlight is we've color-coded our providers on the map by their status. The blue and green providers are providers that have a high class score. Our red and orange providers are providers that have a low class score, so their class performance is below the cutoff or the threshold. And then our white and yellow providers are providers that don't have a class score, but could be accredited or achieve gold seal status in the state of Florida.
And
one
Herman,
of the things,
can you speak a little bit more in depth around what is represented when you pick those numbers? The question in the chat is, do the lower levels of quality, such as the 3.5, also include everything above that? It's everything below that number, right?
So high quality, so if you change the threshold to 4.0, it's 4 and above. So we're setting the floor for our definition for high quality provider in that area. And so you have a score of 4 or higher, you would be considered into that quality category.
Very good. Thank you.
Yep, sure. But what we've noticed is the volume of providers that have gold seal in Miami is higher than typical. And I'm not exactly sure what's gone on before Thrive by 5, you know, in terms of encouraging providers to participate. But I think that the fact that you're talking about quality and that there are tier differentials and reimbursements associated with that gold seal status that I think the providers are leveraging, taking advantage of in Miami-Dade, is that we see a much higher proportion of providers, both above whatever your quality threshold is, as well as providers that are below that class quality threshold that are also gold seal or have some accreditation within the area. But, you know, to make sure we're clear here, when we're calculating infrastructure and selection through the FLICA, we don't consider gold seal status. We're considering only their performance on class for that high quality designation. So this is really for informational purposes to understand what kinds of initiatives providers within the area are participating in. And so we can jump up to 5 in the area, and we see that there are some opportunities to grow when we change our quality threshold from 4.5 to 5. But really, when you're looking at the map, Miami's, I think, still different than a lot of other communities in that our providers are right there on the edge of 4.5 to 5, as opposed to, you know, seeing a dramatic shift in your infrastructure when you switch it from 3.5 to 4 or 4 to 4.5. And so you don't see that real shift until you go up into 5.0 when we're looking at infrastructure in the Miami-Dade County. So I'll pause here and see if Rachel and her team have other things that they want to share related to this, or if there are other just kind of general questions about FLICA or the Sunshine Portal.
There is a question about if there's been a study that assesses the relationship between class scores and outcomes. And I don't know if that's something that you can answer or point to.
Specific in Florida or more
In
nationally?
Florida.
We haven't done that study. That's something that's kind of on the horizon with what we're doing with the Sunshine Portal. But it's not just a look at whether or not they're enrolled in a provider with a high class score or not, but we're really looking more comprehensively at all of the services and supports children and families have participated in between birth to age 5, that looks at their access to healthcare, their participation in the child welfare system, their participation in early childhood special ed, food nutrition services, parents' participation in TANF, housing. And so that we're trying to really describe as much of the kid's background so that we can attribute appropriately what is reasonably associated with their outcomes, and school readiness or participation in the VPK program would be part of that.
Mm-hmm. Yeah, it made me, the system's remarkable. And one question that I had asked you before is, why can't you pull more data into the system so we can get an even more rich picture of what's going on in the state? So I'd love for you to share with the community kind of what the steps are that you actually have to go through in order to insert, administrative data into the system.
Well, I mean, we could probably do 75 minutes on that, but I mean, I think
just high level.
I think
who you're coordinating with.
Yeah, I mean, I think starting with agency level buy-in from the agencies and organizations that are managing these programs is that they need to understand first and foremost that they can trust us to not use the information or data they give us in a way that we haven't already disclosed that we're going to use it, that we're going to protect the identity and personal identifying information that are necessary for us to do cross-program linkage to do this, and have communicated to them our process for importing the data, linking the data, separating those data from the personal identifiers, and then conducting our analyses. But then also communicating with the people at these different agencies to identify what do they want to learn as a result of what we're doing with the analysis, and providing a venue and an opportunity to then share back what we're learning so that everyone can identify how they can maybe change what they're doing to result in better outcomes, or what are the things that we need to continue to do, or what are opportunities for intersection across agency. And so that if we can identify that service A and service B really do synergize to produce better outcomes for kids and families, then we need to get those programs better connected so that we can help support better enrollment in both programs for children and families as they're participating.
Thank you.
Sure.
I also wanted to give the Miami team an opportunity to talk about the diversity of the community in Miami. We talk about if you can do it in Miami, you can do it anywhere, because we've got a large number of immigrants, many different languages being spoken, providers who are nestled in communities that are have strong ethnic identities that are just part of their community and how they work together. Can you speak to how you were able to develop relationships with providers to invite them into partnership in developing this model out?
You want to take that, Jennifer?
You can go, Rachel. I can chime in.
Okay, I think that, yes, our community is certainly diverse in so many ways, many of which you just named, but also just in geography, right? Like we're almost in the Florida Keys, and then we're in, up by Fort Lauderdale, Miami Gardens. So just the geography is huge. So I think that what we've really been intentional about is respecting everybody's neighborhood, sort of like how we learn from quality counts is that it isn't a one size fits all. Like every program, every neighborhood, every family, every child may or may not need the same, and we just need to be okay with that. That in some neighborhoods, it's going to be like, you know, dark red on Herman's map, and other neighborhoods, it's going to be almost white. And so we really need to put more into the dark red neighborhood. In our selection process for our advisory committee, we ask a series of questions, and we spend, I think, 2 hours with our Thrive by 5 partners, being very intentional about having family childcare homes, having large providers, having small providers, having providers from the South, from the Central, from the North, having providers that speak, you know, Spanish, that we got someone that speaks Haitian Creole this time, that, you know, is from all race and ethnic backgrounds, and also neighborhoods, because you can also, there are different, you know, there are diverse populations within specific neighborhoods in Miami-Dade County. So I think just really trying to be, you know, intentional and spending the time to make sure that everybody is equitably represented has been helpful to building out our system.
Yeah.
And oh, go ahead, Jenna.
Yeah, and I just wanted to echo, and I think a very important aspect too of our diversity, and Rachel said it, but like language, you know, language is a very a key component to the way that we think about how we're providing like service, especially for the workforce, in terms of like ensuring that some of the professional development supports that our workforce are receiving are, you know, being provided in the language that helps them. I know that a lot of our efforts that we want to continue to promote is ensuring that our dual language learners, children, are able to receive the supports that they need. So I just wanted to chime in on that in terms of even looking at the diversity of our community. Yes, diversity in the sense of an immigrant population, people coming from different countries, but also in language, and how we see that as a very important aspect of continuing to support enriching early learning environments.
I think there was a question also in the chat from our colleagues in Palm Beach about parental access, just I think with the scholarship program. So I just wanted to say that we do respect parental choice. I don't know if we've mentioned, but in our scholarship program, we're building off of the school readiness program. So families actually apply for the subsidized childcare program. When they don't qualify because they're over the 150%, they move into our program. And so while we do want to respect parental choice, we are also only willing to pay for scholarships in high quality programs. So while when you saw on Herman's map, we allow our families to use their scholarships in 5.0 centers and above, so that they have a class composite score of 5.0 or above, meaning they're in our system tier 4 and 5. So we are not willing to let them take the scholarship to a tier 2. We have tier 2 or tier 3, you know, lower quality programs participating in our system, and we appreciate them, and we're supporting them on their journey to become a higher quality program. But in terms of paying for slots, we only are supporting those at this time. And so the parent receives a map, they receive a list, and they sort of, the Early Learning Coalition is willing to help them. And they go about, you know, visiting programs and finding the program that's the best fit for their family. And then the co-payment for that is $70 a week.
So they have choice, but choice among all high quality programs that you all have confidence in. How did they receive that that direction?
Well, yeah. Well, it caused some complaints in the beginning, because of course, when a child comes to a program and they want to take their child there, and then they come with their scholarship, sometimes they go to other programs, or sometimes, they don't follow the list. And so of course, other providers all of a sudden, how do I get on that list? I want to participate. I want to be, on the scholarship list. So luckily, we have seen a lot of programs improve their quality and move from tier 2, from tier 3 up into tier 4 and 5. Because as Jennifer mentioned, that was one of our lessons learned, is that we need to be able to help to control the market a little bit. And so when you have childcare programs, you saw Herman's map in Miami-Dade County, all over the place, oversaturated in certain neighborhoods, then we really want to work on filling up and building capacity in the ones that are high quality. Because even the high quality ones are not going to be able to maintain it if they're only half full. So that was another one of our goals at the program level, is like, let's build up and support the high quality programs. And we do have, we have a range. We have we could have family childcare homes or a center that have one scholarship child, but we have some centers that have over 20 scholarship children, meaning that we are supporting more than a full classroom of children in those high quality centers in high poverty areas. So that's, another one of our goals. And it's very motivating for people to really support their teachers and work to get on that scholarship list.
Awesome. Thank you. We are closing in on the end of our hour and 15 minutes together. And so I wanted to give everyone an opportunity to think about what piece of advice you would give as folks are thinking about re-envisioning their QRISs. With Build Back Better, this is an opportunity for folks to really think about what they want to change and make some really meaningful system level changes. And so I'd love for each of you to be able to provide just one bit of advice. And if you all have advice from our participant community, I'd love for you to drop that in too, because we want to share that information broadly. And then I'm also going to just make sure everyone is aware we have an evaluation at the end of this that we'd love for as many people to respond to as possible. So with that, whoever wants to jump in with a piece of advice on how to rethink your next level of quality improvement.
I'll go first. I would just say, speak to your providers, get out in the community, speak to providers, speak to parents, spend time in programs. And then secondly, call everyone. I mean, I constantly pick up the phone. I'm calling all over the country to find whoever's willing to, share what they're doing, how they've gotten there. I know when we were building the mental health consultation, I called like 12 different states to gather information. So I think, be curious but most of all, listen to the community.
Yeah, and I feel like some of what I was going to share is probably, similar to what Rachel is saying. I think being sure to incorporate those that you're wanting to serve in the process of planning and in the process of creating whatever system that you're developing is critical. I think often, sometimes we can think we're the experts in how we can provide, or how services or things should be provided. But to Rachel's point, I think engaging, with our early learning educators, engaging with program providers, engaging with children, and families. I think they're the ones who really are the expert and know what it is that they need. And I think the conversation should be making sure that we include them in the process of planning and not just, after the fact, right? So that's probably one key thing I would recommend.
Yeah, and I can just jump in by saying, I think really focusing on that trust piece with the providers and, showing your respect and trust within them as you're building your program that, as Jennifer and Rachel both mentioned, they are the experts, and trusting that they are going to utilize the services that you have built together for the betterment of both their staff and the children.
Awesome. Herman, you want to wrap us up with your piece of advice?
I think listen to these ladies and this group from Miami. I think that, from my perspective, they've really thought through the whole enchilada, if you will, and attended to many different facets of what it takes to result in higher quality supports and services. And I think that, some things that I think really stand out to me is their attention to the clients that they're intending to serve, and in making sure that childcare providers, operators, teachers' voices are heard as it relates to the kinds of supports that they need and the kinds of supports that they're going to benefit from. And I think there also is a default position to trust and to support, and that, right? And so they're not just killing folks with accountability to verify that they've done everything from a compliance mindset, but instead they're coming from a supportive place to identify, you guys tell us what you need and let's figure out a way to get it to you.
Yeah, thank you everyone for such great words of wisdom. And I would just close us out by saying I've known Rachel for many years, and I think another key part of her leadership that's really helped out has been Rachel always believes that there is a better way. And as well crafted as the work is and as accomplished as we are in our efforts, Rachel is never satisfied. So if everyone can maintain a little bit of dissatisfaction, then I think that can be a powerful driver. So thank you all again. This has been a wonderful hour and 15 minutes together. Appreciate your time.